welcome to Africa on the Move in partnership with DW. I am Funmi Unuajefe. Now, this episode is focusing on the ingenious ways Africans are finding solutions to health and addiction challenges on the continent. We start with Burkina Faso, where a team has created soap to prevent people from malaria. Yes, you heard me right, soap. Now, let's see how that works.
Dusk is hunting time for the world's deadliest insect. The Anopheles mosquito is responsible for malaria, a disease that kills nearly 1 million people each year. But now a young chemist has come up with an innovative way to fight both the mosquito and the disease. His ambitious goal is to save 100,000 lives by 2020. For decades, people in Africa have died of malaria. The disease is responsible for many problems here. I think it's important that we Africans ourselves find a solution. But that's not so easy. Each year, some $2 billion are invested in anti-malaria programs, but so far all attempts to eradicate the pathogen have failed. Many approaches are both expensive and impractical, says Gérard Nyondiko. He wants to do it differently, with a simple but effective weapon. We decided to work with soap because it's a product that can be easily integrated into people's everyday lives. Soap is used in 95% of all African households, including the poorest. Faso soap is not only an effective cleansing agent, its smell also repels mosquitoes. The protective function is based on a combination of essential oils obtained from local plants. At night, nets keep the mosquitoes at bay, but during the day and early evening, there's little protection. I'm a construction worker and am very exposed during working hours. I often get bitten, so it's hard not to get infected with malaria. Repellent creams are expensive and rarely effective. You have to constantly reapply it, and you still get bitten. Faso soap will cost no more than conventional soap and promises protection during the critical times of the day. Our goal is to provide 6 hours of protection. This would halve the risk of infection. The idea of creating an anti-malaria soap came to the chemist while studying for his master's degree in Ouagadougou. At university, we did courses on setting up a company, like how to design a product, what benefits it will bring, etc. It was an eye-opener. Since 2015, Gérard has been supported by IT specialist Funmi Unuajefe.
Mainly, I came here because of, the vision of Gérard about a new innovative way to tackle malaria, and I was, excited to join Gérard and see how we can work together to fight malaria.
Funmi Unuajefe takes care of the financial side because research is expensive.
In Burkina Faso, it's pretty difficult to find funding for innovation. You find money for development projects. So if you want to dig, holes, to find water, or if you want to build a school, you can find money. If you want to innovate to create something, like what we do, it's more difficult.
In early 2015, the project was at risk because there were no funds. Then a crowdfunding campaign brought in more than 70,000 euros. I always tell myself if I can save 1 life or 2 or perhaps even 100,000, my greatest dream will come true. And the sooner it does, the better, because every 2 minutes a child still dies of malaria.
Still on malaria, we head to Benin, where green medicine is used to combat malaria.
Benin is a country with a great variety of plants. The API Benin company uses some for medicinal purposes. Which ones exactly, the company won't say. The fear of being copied is very high. API Benin produces over 50 herbal medicines. The knowledge has been handed down through generations of healers. The malaria treatment known as API Palu also has its roots in traditional medicine.
For us, it's great to experience this moment in Africa, especially in Benin. We're now able to produce effective drugs. They're a local African response to local African problems.
So far, API Pelu is an approved treatment for malaria in 5 countries in West and Central Africa. Thanks to exports, more than 300 employees now work for the company. In 2014, it earned 500 million CFA francs, which is approximately 760,000 euros. Money that is urgently needed for infrastructure. In the rainy season, the trucks that deliver API Benin's medicines regularly get stuck in the mud of unpaved roads. Traffic only flows in the business center Cotonou, about 100 kilometers away. Valentin Agon started the green medicine in Benin 25 years ago. The remedy against malaria is a source of great pride.
In Africa, 3,000 people die from malaria every day. As a researcher, you cannot close your eyes and wait for the solutions to come from elsewhere. That's why we decided to fight against this disease ourselves. To do so, we use herbs known to our parents and ancestors.
The API drugs are sold by the company's own pharmacies. So far, there are 300 countrywide. The capsules against malaria are purely herbal, Agon says, and have no side effects.
Ours cost €1.50, theirs costs €10. That's the difference. Another is, of course, that we're close to nature. You can say we are plants. Well, they represent molecules and synthesis. Nowadays, people want plants.
The people of Cotonou are happy to buy the medicine. In addition to the effect, the price is also a decisive factor. For people with an average per capita income of €1,300 a year.
Now, next up is the spice man in Zanzibar, Patrick. He's sharing his tools and knowledge with spice farmers.
In Zanzibar, you can find many of the world's spices. But the times when you could get rich from trading these spices are long gone. Before, all the farmers in the area depended on tourists. If no one visited the farm, it was difficult to survive. A lot of them had to give up and looked for other work. Together with his neighbours, spice farmer Patrick Maganga has managed to corner a new market. Among the spice farmers of Zanzibar, he's considered an expert, and all the others come to him to buy new seedlings. I think it's because I exclusively use cow dung and select the plants very carefully. Along with 30 other spice farmers, Maganga founded a cooperative. Since then, the farmers have shared everything: tools, labour, and above all, knowledge. Together, they've found a way to expand. Cloves are now grown on a large scale. Maganga's neighbour, Ali Faum, explains how the approach led to success.
We decided to be certified organic. And when we sell to our customer as organic, the price is increased. Yeah, from 15 to 20,000 shillings.
The cooperative is a young company based in Stone Town. It seeks out organic products from the islands. All the spices are hand-picked and then shipped to Europe. Farouk Musa is pleased with the close cooperation with the farmers.
Nowadays they have a market, they know where they can sell their stuff, so even the production is a little bit higher. And last year it was about 500 seedling of the clove they've already planted, so probably after 2 years they'll start to harvest more 500 new plants.
Patrick Maganga has been able to build a new house with the additional income. His wife is very happy. I'm very proud of him. Life is much easier than before, and the family gets everything it needs. More and more people who have seen how successful we are with the organization now come here. It's the only way to make good money around here. His oldest son now has his own small family. Maganga is hoping to use the profits from the next harvest to build him a house.
We'll take a quick break. When we return, Africa on the Move will still be here. Thank you for staying with us. Now, alcoholism is the leading cause of gender-based violence and car accidents in Cape Verde. A rehabilitation center was started in 1996 in the country to help recovering alcoholics.
This wood was going to be thrown away. Now Janilson Fernandez is using his carpentry skills to make it into a cupboard. 9 months ago, he was struggling with alcoholism. Then he came for help at El Shaddai Tents, a rehab center in southern Cape Verde. Now he works from dawn till dusk, 7 days a week. The cupboard is a gift for his mother.
Ela me ajudou muito e me deu bastante conselho.
She helped me very much. She told me to stop drinking alcohol, to overcome this addiction.
Ela me apoiou muito.
She supported me a lot and advised me. And now that I'm here in this rehab center, I think she'll be very happy with what I'm doing for her.
When he was younger, Janilson dreamt of being a lawyer, but at the age of 19, he started drinking. Later, things got out of hand. Janilson punched his brother and was ordered to pay a fine he couldn't afford. He then started drinking heavily and spent all his money on alcohol.
Já estava meio morto, porque já foi espancado por thug.
I was half dead because I was beaten up by thugs 2 or 3 times. I almost died.
À beira da morte.
I was hospitalized and in a coma. And then I just thought about my daughter, because I love her very much. I think about her all the time.
At El Shaddai Tents, there are strict rules. All 40 residents of the center are woken up at 6:30 in the morning. After morning prayers and breakfast, they start work. There's bread to be baked. And some at the rehab center work on the organic farm, which provides food for the residents. Whatever is left is sold in a nearby village. The profits come back to the rehab center. Honorio Fragata founded it in 1996. The 68-year-old says there's a lot more work to be done.
What's the main cause of death in Cape Verde? Alcoholism. What's the #1 cause of car accidents? Alcoholism. What's behind gender-based violence and broken families? Alcoholism.
More than 3,000 people have passed through the center since it was founded, but now it has hit hard times. At the moment, it's difficult to pay electricity, water, and food bills. Many patients stay here after their recovery because they can't find a job. Janilson Fernandez is among those struggling to leave El Shaddai. He hasn't given up hope of making a living through carpentry to take care of his family.
From helping alcoholics, we go to helping polio survivors. Abdullahi Rilwani is a survivor himself, and he's leading this cause.
These steps were once an insurmountable challenge for Abdullahi Rilwani. It was such a daunting challenge that it dashed all his hopes for the future. Because he couldn't climb stairs like these when he was younger, he was forced to abandon his studies.
When I was studying, I was not as big as I am today. There are some of my colleagues, students, if they feel I'm tired, some of them even assist me by even carrying me at their back. You understand? But this will not go well for me, and I will not even make it very, I will not even appreciate it that way. I prefer a situation where I'll be using my wheelchair myself.
Along with others who have the disease, Abdullahi Rilwani founded the Association of Polio Survivors of Nigeria. They teach one another practical handiwork and build their own wheelchairs. Rilwani says life isn't easy for people with disabilities in Nigeria. It's difficult to get even a basic wheelchair. This three-wheeler is a luxury model. The association also builds beds and other pieces of furniture. It creates jobs and extra income for many polio survivors. But there are still some problems.
Whenever we produce product, the society seems not to patronize the product because of some of them. I don't even know whether some of them think the product are disabled or are polio victims too. So these are areas we really want the government and the society to believe that all the product we are made has nothing to do with our disability. It is part of our abilities.
Abdullahi Rilwani is a dedicated activist. He travels widely, telling villagers the importance of getting their children immunized against polio. Public health campaigns like his have greatly reduced the numbers of children contracting polio in rural areas.
You don't even need to talk much. If polio is not real, why should I be disabled? Why should I be a cripple? Why should I be crippling? So it's as a result of not being immunized when I was a kid or when we were a kid. That is why we are having one disability or the other.
After work, Abdullahi Rilwani visits the family of a friend who's also disabled as a result of polio. Rilwani married last year and now has a child who's healthy. Despite what many people believe, polio is not a hereditary disease. Much has changed for the better in recent years, thanks in large part to Abdullahi Rilwani and his work. He's a very old friend and the best campaigner I know on behalf of our cause. Abdullahi Rilwani wants to resume his studies and pursue a course in law so he'll be better skilled to help people with disabilities fight for their rights. In Nigerian society, he says, they're still marginalized, so they have everything to gain.
And finally, in Africa on the move, in Togo, a doctor is bringing relief to the rural areas.
We're in Chaplemé, 70 kilometers away from Togo's capital, Lomé. Dr. Michel Kodom is one of the few doctors who comes by regularly. The checkup is free. His nickname here, the poor man's doctor. We're trying to treat these students for all possible parasites and to check that they are healthy for the start of the new term. Dr. Kodom founded the organization M Afrique 10 years ago. His goal? Providing health care for all. If we didn't make the effort, we wouldn't be able to reach these people. That's the biggest problem. Did you see how long it took to reach the village? So it's a problem of mobilizing the resources. Chaplemé doesn't have a health centre, just a public school. Kodom's regular visits are the only health service the 1,500 villagers get. Today he's accompanied by a representative from the Ministry of Health. Togo's government is unable to pay the doctor. So Kodom uses every occasion to call for donations. The ministry representative is impressed by his work. I don't even have the words to describe this. It's an extraordinary effort. The next morning, Kodom is back in Lomé. Not even the capital has a well-functioning healthcare system. In his private clinic, the doctor sees patients who can pay for their treatment. The idea, those who can afford it should also pay more. He uses the money he earns to finance his trips to the villages. A miniature solidarity system, with Kodom at the centre. We always tell ourselves it's great to treat the patients who have insurance and the money to pay us. But it's also important to think of those who don't have the means to visit a clinic and get treatment. But the money is not enough to provide medical care for Togo's entire rural population. We unfortunately don't get any support from the state. We have to ask for donations for each and every trip. And we still haven't got enough for the next trip in 1 or 2 months. But we won't give up hope. Michel Kodom and his helpers have treated over 300,000 people in Togo in the past 10 years. He's even taken his mission beyond Togo's borders. The NGO M Afrique now operates in 6 other West African countries.
And that's all on African on the Move this week, and sure to be part of the solution in your community. I'm Funmi Unuajefe. See you again next week. Bye.